Hello my fellow teammates and all the audiences that I appreciate who will watch this presentation. On this blissful occasion, we from the small group discussion, B3 group would like to present our student project entitled Prescribing for Urinary Problem. But before moving forward to the next plan, let me introduce all members of this group, which is shown in the slide. Next. Okay, for the first speaker, time is yours.
Hello, my name is Wayan Ariawan with 073 as the last 3 digits of my student number. This time I will explain about the patient's problem. So based on the case given, there is a 45-year-old woman who brings her urine analysis and microbial urine analysis. It was found that a microorganism isolated from her urine grew on a using methylene blue or EMB agar, produced green colonies, was motile, and was uridase negative. Based on the characteristic, the microorganism living in her urine is E. coli. Now, the patient is also experiencing burning sensation when urinating or dysuria, bladder pain or cystitis, and frequent urination with small volume or pollakiuria. By linking her chief complaint with previous finding, we can conclude that the patient is suffering from uncomplicated UTI caused by E. coli infection, which also has a tendency to occur more in women. This is all from me. The next one will be explained by my colleague. Thank you.
Thank you for the time. My name is Yuda, and I would like to explain about the therapeutic objective. A therapeutic objective refers to the desired outcome of the therapy, expressed in a manner that holds significance for the patient. To determine the therapeutic objective, the clinician must know how to make good therapeutic objective by considering some clinical manifestation of the disease. In this case, there are four therapeutic objectives. The first one is eliminate the E. coli in her urinary tract as a source of infection. The second one is treat her bladder pain. The third one is treat the sense of burning and her urination. And the fourth one is allow her to get back to her normal level of urination. That's all from me. For the next speakers, the time is yours.
Thank you for the time. My name is Sara Putri Bungaran with 078 as the last 3 digits of my student number, and this time I will explain about suitability and efficacy in general. A woman suffering from acute and complicated UTI that is caused by E. coli infection will be given several drug options based on the therapeutic objective that have been determined. A balance between effective symptoms relief and judicious use of antibiotics is needed. Therefore, it is very important to assess the suitability and efficacy of several drugs that will be used as treatment for women with acute and complicated UTI that is caused by E. coli. Based on the patient's history, type of UTI, local resistant pattern, and cost considerations are some of the things that we consider in selecting these treatments. Nitrofurantoin, fosfomycin, and sulfamethoxazole trimethoprim are the first-line options that we suggest. Second-line options are beta-lactams, namely pivmethylinen, and certain cephalosporin, for example, cefpodoxime, cefdinir, or cefaclor. Here, we will explain the suitability, safety, and efficacy of the first-line options only, which are nitrofurantoin, fosfomycin, and trimethoprim. Maybe that's all for me. Next, we'll continue by my colleague. Thank you.
Greetings everyone, my name is Joanna with the last 3 digits of my student number 079. This time I'm going to explain about the active substance and dosage forms for prescribing for urinary problems. The first one is nitrofurantoin. Nitrofurantoin is one of the first-line oral medications used to treat uncomplicated UTI, and it has nitrofuran as the active substance, and functions as an antibiotic and anti-infective, but it is also a hepatotoxic agent. Dosage forms of nitrofurantoins are capsule in microcrystals, 25 milligrams, 50 milligrams, and 100 milligrams, capsule in monohydrates in 100 milligrams, and oral suspension in 25 milligrams or per 5 milliliters. The second one is fosfomycin. Fosfomycin is an oral broad-spectrum antibiotic with antimicrobial and bactericidal properties, primarily used to treat uncomplicated UTIs. It is a phosphoanyl pyruvate analog, an epoxide antibiotic, and one of the derivatives of phosphonic acid. The dosage form of fosfomycin is 1 3-gram sachet as a single dose, which should be dissolved in a glass of water and taken immediately. The last one is trimethoprim. Trimethoprim, an antifolate antibacterial agent and an aminopyrimidine, is used as a monotherapy of urinary tract infections. The dosage forms of trimethoprim are listed as oral in liquid form, 50 milligrams per milliliters, and oral solid form in 100 milligrams and 200 milligrams. That is all from me. The next one will be continued by my dear friend. Thank you.
Okay, thank you for the opportunity. My name is Putu Sri Dianingsih with the last three-digit number 71. So here I will present about the suitability of the seat schedule. The first drug is nitrofurantoin. It will be given in the two conditions. The first is when the acute UTI, it will be given in the schedule 50 mg 4 times daily or 100 mg 2 times daily. And when the chronic UTI, it will be given in the schedule 100 mg 4 times daily. The second drug is fosfomycin. It will be given in the schedule 3 grams single dose. And the last drug is trimethoprim. It will be given in the schedule interval 12 hours or 2 times daily. Okay, that's all for my presentation. The next one will continue with my colleague. Thank you.
My name is Dian, and my last digit of my student ID is 070, and I will continue the presentation. Suitability of duration. The first drug is nitrofurantoin. Nitrofurantoin is one of the drugs that we use to treat urinary tract infections and has been used since the 1950s. The current recommendation for nitrofurantoin treatment duration is 5-day treatments. The next one is fosfomycin. So fosfomycin has a comparable efficacy and safety profile with nitrofurantoin. Many countries adopted fosfomycin to their guidelines for urinary tract infection treatment, which are uncomplicated infections and infections caused by multi-drug resistance bacteria. The recommended treatment duration of this drug is 3 grams in a single dose. The next one is trimethoprim. So trimethoprim antibiotic is one of the selective drugs for uncomplicated urinary tract infections in many countries. According to IDSA clinical practice guidelines, the appropriate duration for trimethoprim is 3 days. For the next presentation will be continued by my colleague.
Thank you for the time. Now I'm going to explain about the description of pharmacokinetics. The first one is nitrofurantoin. Nitrofurantoin has two forms and treats urinary infections. It is mostly absorbed in the small bowel, and taking it with a food increases the concentration in urine. However, a portion is excreted unchanged, causing brown urine. The second one is fosfomycin. Fosfomycin is a unique drug with wide tissue distribution, including inflamed areas and infected lungs. It requires dose adjustment in patients with impaired renal function, and more research is needed for dosing in critically ill patients with different dialysis methods. The last one is trimethoprim. Orally taken trimethoprim is rapidly absorbed and metabolized in the liver. It is primarily excreted through urine, active in its unbound form, and can cross placental barrier and enter human milk. Next will be continued by my colleague.
Okay, thank you for the time. And now I'll give a brief explanation about the description of pharmacodynamics, or in simpler terms, the adverse and side effects of consuming these three drugs. So first off, we have the consumption of nitrofurantoin, which will likely result in pulmonary and hepatotoxicity, while common side effects of the drug are nausea, vomiting, and diarrhea. And next we have fosfomycin. After oral administration, one might experience mild gastrointestinal disorders, with abdominal pain, diarrhea, and nausea being a few examples. Blood count fluctuation and headaches can also occur, although somewhat rarely. Lastly, trimethoprim. Taking the drug might induce rashes, photosensitivity, and folate deficiency, while its possible side effects include dizziness, fatigue, nausea, and swelling. That is all for now. I will let my partner continue.
Okay, thank you for the time. I am Trianti with 3 last digit number 86, and I will deliver the chapter 3.6, Determining of Drug Choice, Drug Dose Form, and Dose Regimen. The active substance in this medication is fosfomycin trometamol, which is available in the form of one sachet containing 3 grams. To consume it, the sachet needs to be orally dissolved in water, and it is taken only once. The recommended dosage schedule for this medication is to take 1 sachet 3 grams as a single dose for 3 consecutive days. The durations of this treatment is depending on the specific monitoring interval determined by your healthcare provider, which may vary depending on the individual's conditions and response to the medication. It is essential to follow the prescribed dosage and durations as instructed by your healthcare professional to ensure the best possible outcome of the treatment. For the next speakers, floor is yours.
Hello everyone, my name is Gabriella Ferenina with 081 as the last 3 digits of my student number. This time I'm going to explain about the prescription. In here we got the prescribing form from Dr. Benjamin to Mrs. Candice Flynn, age 45 years old and weight 60 kilograms. The prescription was written in Denpasar, May 26, 2023. The drug that prescribed is fosfomycin trometamol, pulverized or powder, 3 grams, and in total she will receive 3 sachets or 9 grams of that. She has to dissolve it in 1 sachet in 100 milliliter water before she drink it 1 time a day for 3 days. This is all from me. The next will be continued by my colleagues. Thank you.
Okay, let me introduce myself. My name is Partha. The last 3 digits of my name is 00. Okay, effective communication, information, and education provided to patients play a crucial role in medical safety. In a given case, fosfomycin trometamine function to address the underlying cause of the infection and facilitate patient recovery. Patients are educated on the proper administration technique of the dosage, which come in the form of sachet containing 3 grams dissolved in water and taken immediately. Patients are provided with 3 sachets to consume once daily for 3 days. Adverse effects may occur such as hematuria, dysuria, urinary retention or difficulty, fever, and lower back or flank pain that should also be communicated to patient. Adverse effect or allergic symptoms such as hives, breathing difficulties, or swelling of the face, lips, tongues, or throat occur. Prompt consultation with the doctor is advised for further action. It is crucial to ensure that patient comprehends the provided information by encouraging them to recapitulate it. That's all from me. The next will be explained by my friends. Thank you.
Hello everyone, my name is Natasha Putri with the last digit of my student number 083. Now I'll explain about the evaluation. Basically, there are 4 possibilities can be happen after administration of drug. First, the disease recovered, and then the administration of fosfomycin can be stopped. Second, disease not yet recovered, be effective and have no side effect. When this happens, the treatment can be continued. Third, mild side effects such as nausea, diarrhea, and vomiting occurred. Passive monitoring can be done with informing patient not to take any anti-diarrhea medication. Last, if there is no improvement, there is serious side effects and allergy occurred, active monitoring is required, especially in CDAD case. Fosfomycin must be stopped and CDAD has to be managed with electrolytes, hydration, protein supplement, and medication for Clostridium difficile. That's all from me, back to the moderator.
That's all from our presentations about our student project. We would like to apologize if there are any mistakes we made during these presentations, and thank you for your attention.